So I just did a previous post on a specifier that could be used in mood disorders that can be helpful in differentiating bipolar disorder from major depressive disorder and generalized anxiety disorder in that case. I really wanted to point out the mixed features specifier though, because it can also lead to some diagnostic ambiguity when we're looking at mood disorders for patients, especially when they're in a major depressive episode, which can happen in major depression or in bipolar disorder. The mixed feature specifier is very helpful because for when a patient does not meet the full criteria for hypomania or mania but has some of these symptoms, we can make sure that we list that in their diagnosis. So a patient may come in with predominantly major depressive disorder symptoms, but they may also come in with some of these symptoms that are listed here. And these are the symptoms that we would be looking for in hypomania or mania to help us differentiate, is this a bipolar disorder? And we could see things like elevated or expansive mood, inflated self-esteem or grandiosity, flight of ideas or those thoughts, nonstop or more talkative or feeling more talkative than normal, increased energy or increased goal-directed activity, so wanting to do all of the activities, all of the things, getting more involved, increased involvement in activities that can lead to potential consequences or harm. We talk about that person that's driving risky or excessively shopping or engaging in maybe more substance use. Another thing to consider is maybe that patient that's having self-harm, because this can also have risky consequences, lead to stitches, lead to infections. And so kind of thinking about that. There are other conditions that come with that are more prevalent with self-harm, but this is another factor to consider. Also decreased need for sleep. So remember though, with this, it's different from insomnia because patients that have decreased need for sleep actually they are less fatigued. They're not really tired when they're not, or when they've lacked that sufficient sleep. So that kind of helps also differentiate that. The other thing we need to consider is this little call out in the bottom is that these symptoms need to be observable by others. And I think we kind of forget that because obviously a lot of times we're getting a patient and they're coming in with their own perspective. But it is helpful because a lot of patients with anxiety or worry or rumination, they might be feeling that these symptoms are actually more significant or that they are struggling. This is still important to address with the patient because we want to recognize their own experience, but we also want to make sure we're not over pathologizing a patient with symptoms that they may not have. Some of the things that can be helpful in this space to help differentiate some of that is to use our screening tools. So the PHQ-9, a lot of people are using that now to screen for depression, but it's very important. We can also use things like the mood disorder questionnaire, or we can use the rapid mood screener. This helps tease out some of those symptoms of mania and hypomania and help do that deeper dive. I do find it is important to go over screeners with patients though, and to make sure that they're considering the time frame as well. Some patients can really look at that screener and they might not read the have you had these symptoms in a 2-week time frame or a period of time where you've had these symptoms, and they might just be thinking about that day. So it's very important to reiterate that when you're doing your diagnostic approach or your interview with the patient, just to confirm that they've really understood the questions, that they've understood the questionnaire, and that can help make us better diagnosticians. It will also help lead to improvement in selecting medications because some medications are approved for, say, major depressive disorder that has mixed features, etc. So it may be more appropriate to add one of those FDA-approved medications than, say, some of the alternatives. So that's what I kind of wanted to leave you with today. I love to hear new science in the space, interest, things that you've seen in practice, clinical stories, please link those or share them in the comments. I'm a huge science nerd, and we learn more by sharing. So please feel free to do so. But for now, that's all I have. Have a good day.